Welcome, friends, to our data cohort. I am so excited you guys are here. For those of you that are attended our senior leadership, this might be a little bit of a repeat for you. However, I am very excited to introduce my friend Joe Coyne with Community Builders, Inc., CBI. Joe has been working with CSNO in conjunction for a project that we are taking on for 2024, which is the Wyoming Data Project. Doug Spriggs and Lindsay, who will be with us shortly, and Kyle Borger attended the Region 8 DataCon down in Colorado. And this is coming from that particular conference about constructing, building, and achieving a strong Wyoming data culture. So I am introducing my friend Joe. He is going to take us through this process. He's going to talk about the maturing of a data process or a data culture. And again, I am going to send you through to your email because you have received an email from CSNO with a link in it to take a survey. It should not take you but a minute to take this survey about your comfort level in your agency, about your data culture in your office. So Joe, you have share capabilities and I'm going to have you take it away, sir.
All right. Well, thanks, Susan, and good morning, everybody. This is going to be a rude shift from talking about football. But before I get there, let me just say that this has been such a tough year for me, primarily because I'm from Michigan. I'm a Michigan fan. And I'm sickened by the cheating allegations, though. So it's been so hard to see them play so well, knowing the NCAA can just simply rip away whatever wins they want and take this away. And it's like, what a bittersweet way to enjoy an entire season. So I'm glad to put it to bed. I wish Nick Saban the best. He's obviously one of the best coaches ever. And whoever fills those shoes has got real big shoes to fill.
Joe, I'm going to tell you, Michigan looked outstanding in the national championship. You have nothing to be ashamed of there.
Yeah, that's the sad thing when coaches and others cheat, it's the kids who end up suffering. And they've played so dang well for so long. I'd love to see some of them stick around and keep playing.
Sounds like
I
when we
think the
do our
think the
data with
portal, yeah.
CG.
I think the portal in NIL has changed football as we know it, which is okay. And I think that's one of the reasons why Nick left, Coach Saban left, and why we're seeing some of our old guard change. And I think it's okay. I think
That could be
some shifts. I think the portal closing after the season is over is probably the best bet. Anyways, we're not going to talk football anymore. Data is where we're at.
okay. You cut out a little bit there, Susan, as you were talking. So hopefully it's not at my end and that doesn't happen here. But as Susan was alluding and introduced to some of you already, we are working on changing the culture of CSNO and the state and really the entire group of people that are working within the CSBG environment. And that's because it really needs to happen. Some of you know my history working as a consultant. I've done a number of community needs assessments across the state. We were frankly frustrated by CNAs because nobody really knew how to use. And we'd put all this work in, recognizing it really needed 4 times more work, only to know that there were, again, just going to be a plan that sit on a shelf. And so this has been a learn for Bobby and I.
So I'm going to interrupt you, Joe. Am I hearing some cutting out as well? Okay, Joe, that might be on your end. I'm going to let's see. I'm not quite sure what to do to fix that. Just so you know, you are cutting out a little bit.
Okay. I have disconnected my VPN, which will strengthen my signal somewhat. And let's see if the problem takes care of itself. Interrupt me again if it continues. How does it sound now?
You're doing good so far.
Okay. So we've had this slow burn going for a while that we really need to fix the data problem. And as most of you know, as we've been talking for years now about Roma and trying to get better at actually planning how to fight poverty and using data and starting to recognize that that data can help us make some decisions. These were all good steps that we've started to take. And so what has been percolating in the background and what Susan has asked me to do is to help us come up with a data-driven CSBG management system here in Wyoming. And the fact is, what we really need is maybe just to organize internally how we can do this, because frankly, lots of other CSBG groups have already taken this path. They've already recognized that with Roma, we we need to be planning with data and using data to figure out, how we're going to fight poverty. Some of you have seen the Roma Next Generation cycle, and what it does is it builds on Roma. It helps us look at it in a little bit more mature standpoint, where we're really starting to talk about how data can be used at each of those steps. Not just a CNA that says, here's your top problems for the next 3 years, but rather, here's all that's going on in your community, and effectively using that at each step of the Roma cycle. That's what we want to do with you guys. That's what we're going to try to do, is to facilitate a conversation and a shift in our culture toward how we all do business, how we engage poverty in our community. And where that process starts is by understanding how each of us actually engage in this fight. And so what other states have done, frankly, what the national CSBG folks recommend is that we all follow the Nevada example or sample of how to do this. And they started by developing a flow chart of how we interact with and keep track of contacts. And it literally starts as people walk in our door or call us or seek an appointment. We, at that point, start to define, is this a contact now? Is this going to become a client? Is it someone that we're going to do an intake on? And then from there, we do the intake and determine whether folks are eligible for service. And if so, we try to assess, where are they now? Where are they perhaps after we've been able to give them this direct service? Sometimes contacts walk in the door and they just need help with a utility bill. Other times it's quite clear, both from them and from your own personal judgment, that case management of maybe their entire family household set of issues would be helpful. And so they might become a case management client, and you help them get hooked up with lots of clients. And as they work through this process, there are still other steps that we look at. We do reassessments and we reassign what type of client we have. And then eventually, what we're trying to do is to help people lift themselves out of poverty and close our cases. And so what we need to do first with you guys is really map this out and see if in fact we are similar, and I think we are quite similar to the Nevada sample. If we are, let's then start focusing our attention on these steps of the flow chart that are highlighted in red: intake, assessment, case management, type of client, direct service, because those are key decision points where we characterize our client, where we start to measure what might help them, what we're going to measure to how they've done with this service. And so come up with a common intake form, one that all of us use, a common assessment, and even for later on, a reassessment form that we all use, how we make these referrals and then follow up with people on these direct services, how we track that service, whether it's just the number of dollars that we've spent or whether it's, an hour of counseling, whatever that service may have been. Let's start to reach some agreement on those data basics and start to see if we can't then build a system. And we do need to approach this from a systemic point of view and recognize that maybe we're on the early stages of a process that's going to take longer than 6 weeks or 6 months. It's going to take years. Frankly, all of us right now are somewhat data aware. We know we're supposed to be tracking data. We report data in our annual reports. We track it for our contract purposes. We frankly are maybe mostly data aware, but we're in the very early stages of this data culture journey. As we start to adopt some basics for principles for what we're going to call clients and how we're going to measure them, and as we start to identify common intake and common assessments across organizations, that means we're starting to mature. We're moving along this data culture scale. And eventually, as we start to actually then adopt those common intake forms and train each other, train our new staff on how to use those things, and get consistent data from the CNA stage all the way through to when we give final reports to the CSBG. Let's make that kind of data consistent and measurable so that we know that we're making progress. And then I think we can really start to learn from the data. That's what leading edge organizations do. They start to gain some insight, and they have aha moments where they realize this is something that I've just learned that would be applicable to others that are in situations just like me. And so this is what we want to do. This is what Susan and I have been talking about doing for a while. And so I've given to her this roadmap of how to get started, and step by step things that we've got to work through, things that we need to do together. And I'll share this roadmap with you. We wanted to get some early insight on where you guys' heads were first, and that's why we wanted to do this survey. But that's what we're excited about doing, and we've now had a few meetings, CBI and CSNO have, and we've just starting to talk to the state folks. And we're at this stage, I think, identifying stakeholders and maybe where those stakeholders are and how we can adjust this roadmap, both in terms of deliverables and what we're actually talking about each week, each month, so that it accommodates what you guys need. So how's that for an introduction, Susan? I'd
That
love to
sounds
answer questions.
Yeah, that sounds wonderful. So I want to tie this all together, and I'm so glad that Heather at the state office was able to join us today. Cecilia is going to be taking the lead at that office to make sure that we're all speaking the common language. But Heather has done such a tremendous job in conjunction with Cecilia about tying the CSBG yearly cycle all together. And what this is going to do is a fully formed manual that you guys will have on site that will be able to train everyone from board members all the way down to case managers in a consistent manner that fits into that CSBG community action yearly cycle. So why do we collect the information we do? We collect it not because it's a box we check on our application or in our organizational standards, but because it's helping us to plan forward. Does it do those things for org standards? Sure, it does. As you guys just all went through organizational standards, and most of you have received my feedback notes, you'll look at, I can't remember the standard right off the top of my head, but a lot of them require us to say, how are you taking your data and analyzing it and planning around it? So when you are going through the very beginning of your application process, that is already the accumulation of a years long practice of looking at what happened during that program year. So as you're planning for what happened in 2025, you know you have good, reliable data by finishing off your annual report in a consistent manner. So we're aware of the fact, and I'm gonna, trust me, I'm gonna turn this over to you, Heather. But Heather is acutely aware that for the past 5 years, every time you're presented with an annual report, you have gotten different guidance about how to answer the questions, right? We don't want that to happen to you anymore. We want a book that's there that says everybody is reporting the same way according to their community. That when we talk about goal 5.3, everybody is very clear exactly what that means. So hopefully this is just another step in making sure that everybody has that consistent, same conformed idea about what our goals here are in Wyoming. Heather.
Thanks, Susan. I think that you summed that up really good. And Joe, thank you for sharing kind of the roadmap moving towards the future. We do know that our data is only as good as we understand it. And as Susan mentioned, there has been a lot of discrepancy from the state on even what is a service, let alone how does an outcome match up with a service, and what exactly is OCS looking for? How do we make sure that our programs are showing the hard work that we're doing, not only with services, but also with our outcomes? And how do we make sure that those outcomes are actually what our community needs? So I'm really excited about Joe and his kind of roadmap that he's going to be providing for us. I looked today at the survey that was sent out to you guys, and really excited to see those results coming back in from our network, because it's really going to be with your guys' guidance to really know where we have fallen short and how we can help kind of shore up this process a little bit. So, and I can't say thank you enough to the data task force, who has really spent a lot of voluntary hours in helping us try to figure out how do we get a system in place that is more effective and more efficient than what we have with the current system. So thank you, Susan.
You bet. And one of the things that we recognize that no software system is perfect. We have unfortunately found that out as we've gone through the task force of releasing an RFP. You know, obviously CAP 60 has its faults, but going through this process, we've really looked and found that there is no perfect system. But we also acknowledge the fact that that is only a tool. The questions and the data culture that we are hoping to develop is bigger than the software tool that we are going to eventually end up with. Software changes, AI is going to be coming into play, everything changes, but our understanding of why we collect the data, how we store that data, how we analyze that data, and how we report that data will never change. The understanding of why we are collecting the data the way we are, the tool may change, but our questions will not. And yes, this will bring Wyoming and our individual agencies closer to compliance with what the federal office wants, but we all know that changes all the time too. But at the end of the day, the people that benefit from us being able to analyze and share our data are the people we serve every day, making sure that we are deploying our resources in the most effective and cost-efficient way, resources that we share amongst our communities and our stakeholders that make our dollar stronger. That is what our ultimate goal is here. And on that note, I want to introduce my friend Deb Anderson. And Deb is here today. A lot of you guys have met Deb before. She was my right arm at the Social Drivers of Health conference that we had in September, because she is a data specialist working with healthcare professionals, where we know we learned this in our conference, right? We need to be better entwined with our healthcare professionals. It's not just our data we're collecting, but I want to go back to the reporting of our data. Who are we sharing our data with? Because that helps all of our communities and our state as well. So I invited Deb to just have a few words about what all of our data can mean in her world as well.
Thank you, Susan. It's great to be here, and hope everybody's staying warm, because it's just a little bit chilly out there. And I'm happy to be here and see Joe as well. It's been a while since I've been able to see him, but I was on an incredible national call on Friday, and I'm so excited because it's the perfect timing for me to be sending this to Susan and Heather and Joe, and others who might be interested. But it talks about how healthcare is finally understanding the true impacts of what we call midstream and upstream factors to better health and well-being. And it includes the social needs. The interesting information is that while CMS and CDC and HHS and HRSA are all excited about us trying to collect the data to help us manage better healthcare, better access, everyone's also realizing there's no easy button approach to this. And one of the things that I've shared with Susan and several others is, as I have gone out to healthcare organizations and said, hey, let's do some of these health social needs screenings, like a Prepare or other tools where we can ask questions in the 5 domains that are important. Do you have transportation to make it to an appointment? Do you have transportation to go pick up a prescription? Can you go buy healthy food, or are you eating out of the convenience store on the corner? There are so many things that do impact better health. And what we've understood now with lots of good data is that if we start shifting some of the supports to midstream or upstream, addressing the social needs, we can improve health outcomes. So I will share some slides and things with you, Susan, and the team, and help you understand that we don't even have our data standards set up officially. There's multiple ways for us to do this, but I also believe that gathering of information is really important and critical. The reliability of the information and the timeliness of the information. So I don't know that it does a provider any good to hear 6 months down the road that, oh, this person had housing insecurity because of a Z code that was put on a claim 6 months ago. Maybe they're not even seeing that patient, or they're seeing that patient because they're presenting in the emergency room or the hospital. These things are, obviously things that are important, and I think we need to address as a team, not just, we call care teams where we might have navigators and community health workers or others who are trying to step in and help us with some of these things, but it's more of that whole. I think what Susan would tell me are the wraparound services that start beginning to end. And I'm excited to see, the fact that this is finally coming together. It won't come together easily, but I think it's truly important for us to learn about the best ways to be working with our populations, becoming their trusted advisors, their trusted team to help them, and, getting consent to share information that may be important to their healthcare team or other teams that are trying to assist them, Meals on Wheels, food banks, whatever that may be. And we're looking at technology solutions that can help us do that with community information exchanges. which Wyoming 211 should be going live fairly soon with our first pilot project down in Laramie County. So again, the information that you are gaining may be better than a receptionist at a medical clinic who might be asking somebody questions that they're not going to want to answer. So, determining how we bring this all together and provide the best support and services from, all the way at the beginning of the stream through the healthcare system, I think is critically important. And what I'm very excited about are the funding opportunities that I think will be behind this, and what HHS is calling backbone organizations. So I need to do a little bit more research. I asked on Friday if there were restrictions to who might be called a backbone organization, but I think honestly it's the groups that can come together within each community to support the needs that are there. So I'm hopefully going to have some more information for everybody in Wyoming, but this will be national initiatives as well. Did that cover everything, Susan?
Yeah, that was awesome, Deb. I so appreciate you. I really wanted to share with you, I had a lot of really positive feedback about Dr. Johnson's keynote speech at the luncheon when we were meeting at the Social Determinants of Health. And I want to bring this to your top of the mind. Do you guys recall what Dr. Johnson said was the #1 cause of death in the United States? Poverty. Because there are too many barriers for them to access healthcare. It's not that we don't have the ability to treat these diseases. We have too many barriers for them to access the treatment. So what we need to do is consider how we're going to use our data, how we are tracking our data, how we are sharing that data with our stakeholders. In particular, Kyle, you guys at WyoHealth did an amazing, and we have to come back to this. You, Align, and your critical care hospitals did a pilot program around a shared needs assessment, but we never followed up with that. What did we find through that needs assessment? How can we partner? And you guys are in a really small community. Those are amazing opportunities because of your small communities that you guys can work together to address those mid to upstream prevention pieces or backbone organizations that Deb was talking about. But we can't do that without good data. Joe and I have been talking with 211. It's not that we are necessarily sharing, we're not combining, or not, that's not the word I'm looking for. Now that 211 is pushing data towards us, it's more like we're pushing data towards 211. So they have the means to be able to report to the state legislature because they're the ones that were given that tool to do so. We've got to be able to speak apples to apples. And this data culture, it's not just CSBG. It is, Joe and I are talking about who are the other stakeholders that need to be a part of that. It is our healthcare, it is our critical care hospitals, it is our federally qualified healthcare, it is our mental health facilities, it is our benefits. So that when we talk data, we are talking apples to apples. Joe, any final comments or anything that you want to add? Oh, Deb wants to add something before you go to you, Joe.
Because I read the chat message again. One of the barriers that we are seeing when we talk to the providers or the healthcare teams are they're scared. They don't want to assess or ask the questions for SDOH when they feel like they have no solutions to address the issues. So that is where our roads will meet. And that is how I think together we will all be able to find some solutions and hopefully as many of our geographies around Wyoming as we possibly can. And some of those solutions may end up being technology to increase access by having a telehealth booth at the library. So there's really exciting things going on, exciting work that can be done. But again, no easy button approach. And I think we're all going to have to dig in and get the information, get the data. 2024, CMS is basically trying to require our critical access hospitals and our providers to do the SDOH assessments. I don't know that they'll be able to enforce it to create, the wonderful data standards, but it's a start. So you will start hearing about, even at the hospitals, that they have to ask a few SDOH questions, housing, transportation, those types of things that they know can impact health. So if you have questions about that, have Susan get in touch with me. I'm working on presentations right now. I still have research to do, but I'm happy to share whatever we learn with all of you so we can stay on the same page.
Deb, there is a working model out there right now through victim services. So right now we have what are called SANE nurses, or sexual assault nurse examiners. This model is when a victim of a crime, a sexual assault crime or a child abuse crime occurs, they automatically, in most areas, have a hotline number that they can call where an advocate, so let's say in Sheridan, where you and I are at, advocacy and resource is immediately contacted when a victim of sexual assault is admitted into the hospital, where an advocate is immediately contacted and is brought to the hospital to be there with that person. There is a model in place where, and I'm not, there's a thing there that we can say, if you find someone is scoring so high on critical crisis care of where they're at, there's a model that we could replicate where a responding WyoHelp person can be called immediately. Lindsay right now, I'm not going to put you on the spot, Lindsay, but Lindsay right now is doing her internship on a micro level as a case manager up at as a social worker up at the hospital. That could be a resource for you, that you're seeing somebody that is at such a high level that you're like, I need to call somebody right now, just like you would if it were a sexual assault person. So there is a working model in place that we don't have to recreate the wheel. So something that we could develop as an emergency situation to triage somebody who has been brought in, particularly around unhoused people or something like that. So anyways, Joe, anything that you would like to add to the conversation before I open it up to the group?
I appreciate all the wisdom that has been shared. And I think collectively, we're all saying the same thing, that moving in this direction requires a systemic approach, a culture change, not just one or two of us starting to get it. And it also signifies, when we talk about things like culture, something that slowly matures. One of the partners that we've been talking about and talking to about this is Wyoming 211. And I've been involved with that group for a number of years. And over the years, that group has matured how they collect data. I mean, it used to just be, if we can't help somebody who calls us looking for assistance, we just, tell them, sorry, we can't help. Well, let's start tracking the number of people that we can't help, was an idea that we had many years ago. And then that matured to, let's get a little more sophisticated about how we record that we couldn't help a person. Is it because there's no service available in their community? Is it because they're not eligible? Is it for some other reason that we're not able to help this person? Is it just, that there's no more money left for that service and they've had to discontinue it in that community? And so when you start to think about a data culture, it's not just like a one and done effort. It is a shift towards using data, collecting different kinds of data and learning to use it in new ways that helps us all become both more efficient and more effective in this fight against poverty. The doctor was right. This is the number one killer. It's the problem in our society. It's poverty. Let's keep this fight up. So I appreciate all that's been said. I look forward to doing this, and I'm still willing to answer any questions that anyone else has, Susan.
That sounds great. This is a perfect opportunity for me to open it up to the group to see if anybody has any thoughts, any questions, any feedback, any pushback.
This is Janelle with the Laramie Reproductive Health Clinic. I just wanted to add that thing that's going on in our hospital, that program is really helpful. They are more than willing to train, and we are signing up to be the follow-up provider for anybody that has been assaulted. And they're actually offering us free training and have put us in contact with Safe Project for the advocacies, people that we would contact. So if you're interested in something like that, just reach out to that same group because they've been amazing.
Janelle, thank you so much for adding that. I really appreciate that because I don't know why it never occurred to me. It's like, oh, I know that there's emergency response through SANE. I'm just wondering how come we can't adapt that a little bit for those clients, and I do think of those in super high crisis, particularly those unhoused that might be going in that need emergency services. I'm not quite sure how that process works in a hospital. Lindsay, I know that you do social work on that right now, but if it's not a sexual assault and someone's in crisis and it's not mental health and you don't have a Title 25, how does that work? Do you know, Linz? Or what do you guys do in Sheridan?
So what, and it's, I guess, a relatively new kind of process, but there is like an assessment or screening that happens when someone is admitted to the hospital, whether they come in through the emergency department or whatever. And it has questions regarding the social determinants of health. So if they are experiencing food insecurity, poverty, any number of issues, then the system automates something to the case management or the social workers to do a consult with that person and try and get them some information about resources that they might need. So to kind of tie it into this overall discussion of, data and how we use it, this is, again, a relatively new process, but we're starting to collect data around, okay, how many of these consults are we getting for what different social determinants of health? What resources do we have available that we're able to refer people to, and what we might be missing? So I think, at least from the Sheridan Hospital perspective, we're beginning to kind of start to inhabit a sort of data culture, and something that, the community action agencies around are going to be really invaluable.
Thank you, Lindsay. I appreciate that. Please note in the chat, Deb just entered in the most common healthcare assessment, so you guys can kind of see what they're at least asking, and you can kind of prepare accordingly. Anybody else have any thoughts, comments, or pushback? Okay. Oh, Kyle, I'm sorry. Were you going to say something? Oh, okay. All right. So here's the deal. A lot of you have heard this information before, but now prepare yourselves because now the work is going to start. Our next step on this is we're putting together our stakeholders. We're going to start meeting on a monthly basis. We're going to start putting these together. If you find information that you find interesting, if you have a particular good process in your agency that you want to share, if you come across a good resource, please do not hesitate to share that with us. Let us know if there's anything that we can do to make this easier for you, some things that you want us to think about. Please reach out to Lindsay, myself, Joe, and we will bring it into the process. Please take your survey question that you received at 10 o'clock today And if there is nothing further for the group, I will go ahead and give you guys back 15 minutes out of your schedule, giving you one last chance for comment.